Have you ever judged someone by what you see on their skin without knowing the whole story behind it? Today, we will uncover the hidden causes, effects, and realities of skin diseases. These include contact dermatitis, tinea corporis, tinea pedis, and tinea versicolor. Through this presentation, we aim to understand their causes, clinical manifestations, and proper management, as well as highlight the importance of early recognition and prevention in maintaining a healthy skin. This is Raquel Damandaman, and we will now begin our discussion.
So let's begin with contact dermatitis. So when we say contact dermatitis, it is an inflammatory skin condition that occurs when the skin comes into direct contact with substances that either irritate it or trigger an allergic reaction. Then this leads to damage of the skin barrier and causes inflammation. So there are two main types. First is irritant contact dermatitis, which is the most common type. So this happens when strong substances like detergents, soaps, bleach, or chemicals directly damage the skin. It does not involve the immune system and can happen to anyone, especially those with repeated exposure. Then the second type is allergic contact dermatitis. So this involves the immune system. When a person is exposed to an allergen such as fragrances, latex, or preservatives, the body recognizes it as harmful and triggers a delayed hypersensitivity reaction. Symptoms may appear hours to days after exposure. Then, what are the signs and symptoms? The signs and symptoms include redness, itching, swelling, and sometimes blisters. In chronic cases, the skin may become dry, thickened, and cracked. Patient may also complain of a burning or stinging sensation. Well, for the management, the priority is to identify and remove the causative agent to prevent further irritation. Then the affected area should be washed with mild soap and water. Topical corticosteroids are used to reduce inflammation, while antihistamines can help relieve itching. Patient education is also very important, including avoiding triggers and maintaining proper skin hygiene.
Good day everyone, I am Laika Mariel Kagumbay and I will be discussing the tinea corporis, commonly known as the ringworm. So despite sa iyahang name, so this skin condition is not caused by the worm itself but rather than a fungus nga naga-infect sa skin leading to ring-shaped na rashes. So unsa may causes ani nga type of skin condition? So this infection is caused by a fungi called dermatophytes which fed on the dead skin, hair, and then sa nails. So this fungi grows well in a warm, moist, and mga sweating areas. So it's spread in three main ways. So first is nga pag-spread is person to person, especially through direct skin nga contact. Second is animal to person, especially sa mga animal nga mga cats and dogs. And lastly is through contaminated nga mga object such as towels, clothes, and then even floors sa public nga mga areas or sa mga places like sa jeep. So that's why people nga ga-sweat nga rapid yun is ug samot na kanang ga-share og mga personal items sila ang mga risk ani nga kind of skin condition. So sa may signs and mga symptoms ani. So the most noticeable nga symptoms is a circular red rash that looks like a ring. So the edges are usually raised and may appearing scaly, pero ang center is look clear siya. So patient also complain itching which can range from mild to severe, and then spreading lesions, meaning the ring gradually becomes bigger, and then sometimes they may be multiple rings in different areas of the body. So these symptoms can be uncomfortable but they are usually not a life-threatening condition. So pag-manage dayon ani nga skin type, so first nato nga treatment. Ang focus atong treatment is to eliminate the fungus and preventing its spread. So first nato nga treatment is topical antifungal nga creams, especially sa mga mild nga mga cases. So these are applied directly to the affected skin. Example ani is ang clotrimazole, miconazole, and then ang terbinafan. So this is gradually applied twice a day for 2 to 4 weeks, or even if the rash start to disappear, so to ensure that the fungus is commonly gone. So second is oral or antifungal nga mga medication samot na sa mga severe and mga widespread na mga cases. So if the infection is extensive or not responding sa mga cream, so doctors may prescribe oral nga medication like fluconazole and then ang intraconazole. So this works from inside sa body para i-kill itong mga fungus. So ang third is hygiene and self-care. So it is a very important nga management. So keep the affected area clean and dry because fungus or fungi thrive in a moisture. Then change clothes daily, especially sa katong grabe kasingot ng mga person. And then avoid sharing towels, clothes, or mga personal na mga items. And then lastly is to wash hands after touching the affected area to prevent spread. So in conclusion, so tinea corporis is a commonly fungal infection that is highly treatable. So early recognition, proper medication, and good hygiene practices are important to prevent complication and spreading. So that would be all sa akong part. Thank you.
So good day everyone. So today I will present to you the condition or the disease called tinea pedis, or also known as athlete's foot. So what is tinea pedis? Tinea pedis is a fungal infection of the skin of the feet, especially in between the toes. So kani siya nga infection, ang affected area ani is ang singit sa inyong toes or kanang diri sa inyong toes. So diri na area. It is caused by a group of fungi called dermatophytes which thrive in warm or moist environment. So kani nga sakit is caused by a fungi, so dili bacteria kundi fungi, which is usually nagapuyo sa mga moist environment, mga basa-basa nga environment. So what is the common cause of this condition? Tinea pedis is commonly caused by fungi such as Trichophyton rubrum, Trichophyton interdigitali, and Epidermophyton plocosum. So kani siya nga condition is caused by this type of fungi. How can a person acquire this condition? So a person can acquire this condition or this infection through direct contact with infected person. So if ang isa ka tao is na ay tinea pedis or athlete's foot and then nag-direct contact mo ato, so mao nang maka-acquire ka pud ani nga condition. And also it can be an indirect contact with contaminated surfaces like public showers, swimming pools, locker rooms, and gym floors. So kung katong mga surfaces or area kay kanang first nagamit ato ang person nga naay athlete's foot and then nisunod ka, so possible nga maka-acquire pud ka ani nga condition. So aside from that, it can also spread by sharing personal items like towels, socks, or shoes. So if makabalo na ta na katong person is naa siya athlete's foot, dili na ta makipag-share sa iya og socks or shoes kay possible nga ma-acquire sad nato ang sakit nga ing ato. So aside from that, napoy mga risk factor or risk factor nga maka-acquire pud ta ani nga condition, such as wearing tight or non-breathable shoes, excessive sweating, poor foot hygiene, walking barefoot in public places just like katong indirect contact, and then having condition like diabetes or weakened immune system. So grabe gyud ka dako nga factor or dali ka matakdan ani nga condition if low ang imuhang immune system. So now let's move on to the common symptoms of tinea pedis or athlete's foot, which includes itching, so katulad niya siya, burning sensation, redness, scaling or peeling of the skin. Aside from that, this condition is baho. So baho ang tiil sa tao nga naay athlete's foot. So in some cases or severe cases, so naay kanang mga blisters type nga kanang naisulod nga watery blister nga gatubo sa tiil sa patient. And aside from that is kung worse na gid kaayo, naay mga continue into ulcers. So what is the common management or treatment of this condition? So the common or usually treatment includes topical antifungal medication such as clotrimazole, miconazole, or terbinafine, which is applied for about 2 to 4 weeks. So in more severe cases, oral antifungal medication like terbinafine or fluconazole may be prescribed. So ginapainom sa patient ni siya if severe cases na. And also for the other management, nursing management for this condition is it is important nga i-maintain yun sa isa ka tao ang iyahang proper hygiene, especially on the foot area. It should keep the feet clean and dry. And then we should also educate client with this condition to change sock daily and avoid sharing personal items and wear breathable footwear. Katong dili guot nga mga footwear. So aside from the treatment and management, naapoy prevention para ma-prevent ni nga condition. So first in the prevention is if magadto ang client sa public areas, kay dili man gid nato mapalaan kung kinsay kasulod gawas ato na area, so di sad nato ka kaila. So always wear slippers and then use antifungal powders if needed, and maintain the feet clean and dry by washing it properly and avoid prolonged moisture exposure sa tiil sa clients. So that's all for the tinea pedis or athlete's foot disease.
For our next topic, it's all about tinea versicolor. So tinea versicolor, it is a common fungal infection that causes changes in the skin color due to the overgrowth of the yeast in our skin. So it is caused by a yeast called Malassezia, which is normally galing siya sa ato ang skin. However, in certain condition, it can overgrow and can lead to infection. So there are several factors that can trigger this overgrowth. So the first nga factor, it is the hot and humid climate, which is very common sa mga tropical na countries like our country, the Philippines. Second is sa mga oily na skin, so because the yeast ka-feed sila sa oil. And then third is excessive sweating, so especially those individuals nga active kayo. And then third is mga weak nga mga immune system like mga pregnant, mga malnutrition, and mga people na naay disease like diabetes mellitus. So unsa man ang mga signs and symptoms of this type of skin disease? We have the main nga symptoms is ang skin discoloration. However, patient may also experience or napod sa mga patients napod sila light or dark na patches, so compared sa ilang normal nga skin color. Second is commonly seen ni sila sa chest, back, neck, and sa mga upper arms area. And then napod maka-experience po sila mild itching, especially when sweating. And then fine scaling, which becomes more visible when the skin is mas scratch. So unsa may mga management ani nga skin nga condition. So first is we have a topical antifungal treatment. So it is a first line nga management. So these are applied directly to the skin. So example ani nga topical nga antifungal treatment is we have ketoconazole shampoo or cream, and then selenium sulfate lotion or shampoo. So they are usually applied on the affected area and left for a few minutes before rinsing, especially when kanang shampoo ang gina-use. If kanang severe or sige nagbalik-balik ni and then dili makaya sa cream, then we are going to proceed sa oral antifungal na medication. So one of the example ani nga mga medication is ang fluconazole o ang etraconazole. So these are prescribed by the doctor. Is topical treatment is not enough, as what I said earlier. And then lastly is lifestyle and self-care. So very important. So it is important to maintain a good skin hygiene, is to avoid also excessive sweating if possible, and then wear a loose and breathable clothing, and lastly keep your skin dry and then clean. So in conclusion, tinea versicolor is common and manageable skin condition caused by the yeast overgrowth. Early treatment, proper hygiene, and awareness of risk factors can help prevent recurrence of this type of skin condition. And that would be all. Thank you.